Does your stomach feel tight, swollen, or painfully full? Even after eating a small meal? Do you often experience that embarrassing gas, sudden bloating, or pressure that just won't go away? If yes, then stay with me, because as a gastro specialist, I want to explain exactly why this is happening, and the research-based home remedy that truly helps. Gas and bloating are some of the most common digestive complaints, yet most people have no idea what actually triggers them. Many patients describe it as a balloon expanding inside their stomach. But the truth is, the stomach is rarely the main culprit. The real reasons lie deeper in your gut and in your lifestyle choices, often in ways you don't realize. Let's start with the root causes. One of the biggest reasons for gas and bloating is how you eat, not just what you eat. Medical research shows that when you eat too fast, talk while eating, or chew your food poorly, you swallow excess air. This air doesn't just disappear. It collects in your stomach and intestines, creating pressure, discomfort, and loud gurgling noises. Another major reason is food intolerances, especially to lactose, gluten, oily foods, or artificial sweeteners. When your body lacks the enzymes to digest certain foods, they travel undigested into the colon, where gut bacteria begin fermenting them. This fermentation process produces gas, hydrogen, methane, or carbon dioxide, which leads to bloating, abdominal pain, and even sudden urge to pass gas. For many people, irregular eating habits also play a big role. Skipping meals, overeating at night, or eating too large portions slows down digestion. When food sits for too long in the gut, it starts breaking down in unnatural ways, increasing gas production. Another overlooked reason is poor gut motility, meaning your intestines are not moving food efficiently. Sedentary lifestyle, lack of walking, and high stress can slow intestinal movements. Stress especially is a big culprit. Research shows that stress triggers the gut-brain axis, slowing digestion and causing bloating, constipation, or alternating patterns of gas and loose stools. Sometimes bacterial imbalance in the gut, something called dysbiosis, can also lead to excessive gas. When good bacteria reduce and harmful bacteria increase, your gut becomes more sensitive, producing more gas from even simple foods like lentils, milk, or raw vegetables. But here's the good news. In most cases, gas and bloating are not dangerous. They're uncomfortable, embarrassing, and disruptive, but very treatable with the right lifestyle changes and natural, evidence-backed home remedies. So let me share one of the most effective home remedies I recommend as a gastro doctor. It's simple, safe, and supported by digestive health research. The home remedy: warm ginger fennel digestive tonic. This remedy works on 3 levels. It reduces inflammation, increases gut motility, and prevents gas formation. Ingredients: 1 cup warm water, ½ teaspoon crushed fennel seeds, ½ teaspoon grated fresh ginger, a few drops of lemon. Why it works: fennel seeds contain compounds like anethole, which relax intestinal muscles and reduce gas formation. Studies show that fennel helps relieve bloating, indigestion, and even mild cramping by preventing spasms in the GI tract. Ginger has gingerol and shogaol, powerful anti-inflammatory compounds. Research proves ginger speeds up gastric emptying, meaning food moves faster from your stomach to the intestines. When digestion is smooth and timely, gas formation reduces significantly. Warm water itself improves motility, helping trapped gas move out naturally. The combination becomes a gentle, natural digestive stimulant. How to prepare and use it: boil the water, add ginger and fennel, turn off the heat, and let it sit for 5 minutes. Strain it into a cup and sip slowly after meals, especially lunch or dinner. Within 10 to 15 minutes, most people feel lighter, less bloated, and more comfortable. Using it daily for 5 to 7 days helps reset digestion and reduce frequent bloating episodes. Now, before I end, here are some quick doctor recommendations to prevent gas long-term. Eat slowly and chew thoroughly. Digestion starts in the mouth. Avoid carbonated drinks and packaged juices. Reduce beans, lentils, cabbage, and milk temporarily if they trigger symptoms. Walk for 10 to 15 minutes after meals, clinically proven to improve digestion. Manage stress with deep breathing or relaxation routines. And remember, if your bloating comes with severe pain, weight loss, blood in stool, or vomiting, it's not normal gas. You must see a gastro doctor immediately. But for everyday gas and bloating due to lifestyle or food habits, this remedy and routine can make a major difference.